This is Will County's News Talk Sports 1340 WJOL. Good afternoon. It's a Wednesday, 12:07. It's time for Policy Nuance with State Representative Mark Batinick from the 97th District, who joins us live in our WJOL studios. Representative Batinick, nice to see you again, sir.
Always good to see you. Love doing the show every Wednesday. We got a big one today, a special one and an important one.
We have a 20-pound show that's got to fit into a 10-pound bag.
That's right. This is the day we said before. I wish we had 2 hours instead of one, but I want to get right into it.
Let's do it.
Because this may be our most important show, and we have somebody that's ready to speak to us right off the bat here. I want to thank Scott Reimers with the Illinois State Med Society. They're an organization that really helps us with some of these heavy bills that we talk about. I'm obviously not a doctor. We vote on a lot of things that deal with medicine, and he hooked us up with Dr. Michelle Brown, who's a board-certified obstetrician and gynecologist at Prentice Women's Hospital in Chicago, part of Northwestern Medicine. She is also a health system clinician at the Feinberg School of Medicine at Northwestern. She earned her medical degree at the University of North Carolina School of Medicine, followed by a residency at the University of Chicago. Wow, those are three impressive universities, Scott. She's joining us today to talk about, should pregnant women get the vaccine for COVID-19? What are the benefits and risks? And I got to tell you, I'm going to ask everybody to just take a second, unwind their brain, and have kind of empty it out of what their preconceived notions are, because I've kind of come full circle on this. And with that, I want to welcome in Dr. Michelle Brown. Doctor, thank you so much for being on the show.
Yeah, thank you for having me.
Oh, this is a real important topic. So, a little bit about why I wanted to have you on the show. I had a couple of instances that actually changed my viewpoint on this particular issue. Why don't you just take the floor about? I've talked about how we shouldn't treat a 70-year-old guy the same as we treat a 7-year-old boy when it comes to COVID and the vaccine and everything else. And apparently, it's important to not treat a 25-year-old woman that isn't pregnant the same way we treat a 25-year-old woman that is pregnant. So why don't you take us through what happened with COVID and the vaccine and pregnant women, and what is the recommendation for people out there?
Absolutely. And you're absolutely right that people who are pregnant are much more higher risk for complications from COVID than those who are not. And that is why the CDC has come out with even stronger recommendations more recently about pregnancy and getting vaccinated for COVID while you're pregnant, you're trying to get pregnant, or while you're breastfeeding. So we know that there is a lot of risk to COVID during pregnancy. Patients who are pregnant who contract COVID are at a 3-fold risk increased for ICU admission compared to those who are not pregnant. They're at a 2.4-fold increased risk for needing ECMO, which is basically oxygenating your blood outside your body. They're at a 1.7-fold increased risk of dying due to COVID-19 compared to those same people of those same ages who aren't pregnant. So we know that people who are pregnant are at so much of an increased risk of complications due to COVID, and that pregnant people in particular are at an increased risk for adverse pregnancy outcomes as well. They're at an increased risk for needing a C-section for their delivery, and they're at an increased risk of needing to deliver their baby early before their due date. And so because we know these risks, we are strongly encouraging pregnant people or people who are considering becoming pregnant or those who recently delivered to get vaccinated, because that is the best way to protect people from needing to go into the hospital and needing ICU admission and to prevent them from dying.
Is there a better time for them to take the vaccination? So a little bit about me. I have 5 kids, so I've been through this several times, and we always worry that first trimester is looked at as a dangerous time. What's the best time that you recommend for somebody who's pregnant to take the vaccine?
As soon as possible is the best time. So we have looked at different trimesters of pregnancy. From all of the data that we have a huge CDC pregnancy database that collects data on pregnant women, and it has been longitudinally following a large cohort of them to look at their status in terms of their pregnancies relative to their timing of getting the vaccine. And we know that pregnant people who receive the vaccine, even in the first trimester, are at no increased risk for adverse pregnancy outcomes, especially miscarriage, compared to any other time during their pregnancy. And the sooner that you can get vaccinated for COVID, the better, because the sooner you can get vaccinated, the sooner you will be fully vaccinated, and that dramatically reduces your risk of needing to be hospitalized or, dying from COVID if you end up catching it.
So I'm guessing I'm going to extrapolate here, and I'm not the doctor you are. It's probably best for somebody to do it prior to trying to get pregnant. So as soon as possible. Is that generally what you're telling women that are coming to your office? And then are there any situations where because of the makeup or immunity issues, or are there any situations where you have to be more careful with taking the vaccine while pregnant?
So we've looked at a lot of different studies where we've looked at large databases for all sorts of outcomes, things like miscarriage, things like stillbirth, things like, other pregnancy outcomes, preterm birth, small size for gestational age, congenital anomaly. We looked at all of these different pregnancy outcomes to see if there's any risk associated with the vaccine in terms of looking at a group of vaccinated patients versus those who didn't receive the vaccine. And there's no increased risk in any of those complications for vaccinated people versus unvaccinated. And to your question about, people who are considering getting pregnant, absolutely. Right now is the best time to get the vaccine because then you're protected. And once you do get pregnant and your body undergoes, the physiologic changes of pregnancy that make you more at risk for COVID, you're already protected.
So do you guys test for antibodies ever? Is that something that doctors are doing with pregnant patients? So let me rephrase that. Let's say you have prior infection and you have immunity, some sort of immunity from prior infection. Is that handled any differently than somebody who doesn't?
So we are still recommending vaccination for people who have had a prior infection. And the reason for that is the type of immunity that you get from a natural infection is very variable. So people who had a really mild case of COVID in the past, we don't know if they are going to be as protected, 6 months, 8 months down the line, compared to people who are vaccinated. The vaccine provides immunity that is we know the data on, and we know that it's highly effective in protecting you against COVID hospitalization and death. So we aren't measuring antibody levels in people who had a history of natural infection because at this point, we don't have a lot of information on what to do with that data. We don't have a great idea of if you have this much antibody in your blood from a natural infection or even from getting vaccinated. We do not have the information right now to correlate that with natural immunity and so with your actual ability to fight infection and to prevent you from getting into the hospital. So antibody levels are not something that we measure in any sort of clinical setting because we don't really have any good information on how to interpret those levels. We don't know if your level is above a certain amount or below a certain amount, if that means that you're at an increased risk for being hospitalized or at a decreased risk for being hospitalized. But what we do know is that vaccinated patients are at a decreased risk of needing to be hospitalized and dying from COVID. And so that is why, even if you've had a COVID infection in the past, we're still recommending vaccination because it is the type of intervention that's going to be able to reduce that risk for you.
So now I have read, and to be clear, I'm a big, one of my phrases is math versus emotion, right? And you're giving me a lot of data points, and you really started the conversation out with the threefold risk of ICU, 2.4 times risk of needing oxygen, 1.7 risk of dying. Actually, some of the studies that I had read, actually, I honestly I thought the mortality rate was even higher than just a 1.7 times risk of dying from COVID if you got it during pregnancy. Some of the pushback that I often hear, and I'm very nuanced. The show is called Policy Nuance for a reason. I don't think there's a kind of a one size fits all. Some of the pushback I always hear is about the VAERS website, and obviously correlation isn't causation. Kind of how do you treat that? I think I've read 25% of pregnant women are vaccinated, and when I talk to some people about my newer thoughts on this, because I got to tell you, I started out by thinking, boy, if my wife was pregnant with one of our 5 kids at this time, I'd want to lock her in the house and not see anybody and just and just get through it. What do you say to people that look at the VAERS website where they have a list of stories that happen? How do you address that with your patients?
Yeah. So the latest data we have suggests that around 31% of pregnant people are vaccinated at this time. So
Okay.
a little better than 24, but still not great. And compared to people of the same age, which that vaccination rate's around 64%, we're still doing a very poor job at getting pregnant people to get vaccinated. In terms of, the databases, so there's the VAERS database, and that basically allows anyone to submit any, what they perceive to be a vaccine reaction to that database. And that is kind of a large collection of individual reports that don't have any kind of validation or backing. It's just a way to collect information. And what the CDC does with these big databases is they look for trends and patterns, and they try to see if any of those, would merit something that requires a study. And so the data that we have to recommend the safety of the vaccine in pregnancy comes from longitudinal following of people who have enrolled in studies with the CDC to look at, I'm pregnant and I'm planning on getting vaccinated. And then they follow those pregnancies throughout the course of their pregnancies into their deliveries and looking at outcomes for the baby. And so that is a controlled study that controls for outside factors. It can account for co-founders, others that are present in someone's life that might, contribute to any particular outcome. And by looking at those, we are able to say that any kind of pregnancy outcome, something like miscarriage or stillbirth, those rates are not increased in the vaccinated population compared to the unvaccinated population. But we do know that for people who get COVID during their pregnancies, they're not only at an increased risk of needing to go into the hospital and dying, but they are not only are they at that risk, but they are at a risk of problems with their pregnancy, especially delivering their babies early, and their babies need to be admitted to the neonatal ICU.
Yeah, and I got to tell you that this is what really turned me. So my son went to school in Mississippi, and obviously they've had COVID cases that are much higher than the national average. And I read a story about a doctor who talked about how maybe there was a number of women within a couple-week period who died either during childbirth or immediately afterwards. And they talked about how sometimes the woman's body will just keep the organs alive long enough to deliver the baby, and then the mother passes right afterwards. And that was the first thing that made me want to research this a little bit more, and that's why I thank you so much for coming on. Can you speak to that at all, about what happens to the body sometimes when a woman gets physiologically, when a woman gets COVID and she's pregnant? And was I reading that correctly? Am I describing that correctly?
Yeah. So when a woman is pregnant, there are a couple of things that happen to her body that increase that risk of COVID. So one of the things is that pregnancy is a relatively immunocompromised state. So the body kind of shuts down some of your own natural immunity when you are pregnant in order to prevent yourself from attacking your fetus, which is, sort of a foreign body in the view of your physiologic system. So all pregnant women are at an increased risk of catching any kind of virus, including COVID. And then also pregnancy creates physiologic changes in your lungs. So as your uterus is growing, it compresses your lungs. Pregnant women can't take as much air in when they are very pregnant, as their lungs are literally squished physically. And hormonal changes that happen during pregnancy also reduce the the amount of oxygen you get with every breath, and it increases the rate of your breathing. And when you add on, so there's sort of a little bit of pregnancy, what we call dyspnea, shortness of breath. And you can ask any pregnant woman this. If you say
I'm aware of that.
Someone is in their third trimester,
yeah, I've been told
all the time.
Yeah,
they can barely walk up a flight of stairs without feeling a little winded, and that's normal. But when you add COVID on top of that, it just really increases their rate of needing symptomatic intervention like oxygen, hospitalization, intubation, things like that.
Boy, that's interesting, and that isn't something that I had read. Last thing, because you have some really important things to do today that I think are awesome, and I appreciate everything you do. Side effects. I mean, I have read some side effect about maybe decreased breast milk for a short period of time after taking the vaccine. Are there any side effects that you're concerned about, or anything that we should alert everybody to?
The side effects that we, counsel patients about, the main one that we think about, there's sort of those mild COVID side effects that everyone gets, like a sore arm or maybe feeling a little fatigued for a day or two. And none of those are really a risk in pregnancy. The one thing that we counsel patients on is that some patients, after they get their vaccination, they may develop a fever. And if that's the case, then we tell our pregnant patients to take Tylenol, because we know there are risks to sustaining a fever during pregnancy. But if you are on top of measuring your temperature and you take Tylenol to bring that fever down, that risk is eliminated. And we know that taking Tylenol also does not decrease the efficacy of the vaccine itself or your antibody response if you take it after you get vaccinated. So that's the only thing that we talk to pregnant patients about to keep an eye on after they get vaccinated. But other than that, there's no risk to the pregnancy above and beyond anything in particular for being pregnant. And we know that the risk of getting COVID while pregnant has many, many risks, including fever. So we definitely recommend the vaccine.
Dr. Brown, I really thank you for your time. Is there anything else we missed or anything I should ask? Or?
Can I ask one question, Doctor? Real quick, could you discuss a little bit? I know you're OBGYN, but I'm sure you'll have an opinion on this, or not an opinion, but just could you speak a little bit to herd immunity? And is that a thing? Are we close in terms of the numbers that you've seen? I'm not just talking about, pregnant people here now, but just overall the population. What are your thoughts on that?
So it's a difficult question, and a lot of epidemiologists are looking at this seriously. And I think the current consensus among the medical community is that we're not really going to reach herd immunity with COVID.
Okay.
It's not going to be something like measles, where there is so many people who have very strong protection that we won't really see it pop up in natural groups. It's probably going to end up being something more like the flu, where we see it pop up every year. And we know that if you get vaccinated for the flu, you're at a much lower risk of needing to go into the hospital and dying from influenza. Even if you end up catching it, which, we're seeing breakthrough cases with COVID, you're still much more protected than if you never got the vaccine in the first place.
Okay. All right.
And so we think that is sort of where we're going to end up with COVID at this time. But again, epidemiologists are the ones to be looked at. But that's sort of where we are right now. And I don't think we are at the point where we're going to reach a point where, all right, enough people are vaccinated and we're no longer seeing COVID.
Okay, makes sense. Thank you.
Dr. Brown, This has been awesome. I really appreciate you coming on. Appreciate all the work that you've done and the good work that you have done and continue to do. If there's anything else, you are welcome on our show at any time, and we really appreciate it. Thank you so much.
Thank you so much, and I just really appreciate you highlighting this important issue. We really need to be talking to our patients more, and all of the doctors that I work with are doing this. But just to get the word out there over and over again that vaccination in pregnancy is safe, and it's super important for preventing awful outcomes like maternal deaths.
Awesome. Thank you for having me. I'm usually on somebody else's show, so thank you for coming on, and we hope to talk to you soon.
Thank you so much. Have a good day.
Bye-bye. Wow, that was enlightening. We are actually going to move to a real case situation. So a little bit about what happened with me is I was, I mentioned about researching the what was happening down in Mississippi, and there was a group of women that had died, and it was some pretty awful cases. And there were people that were normal, healthy women. The doctor talked about how they shouldn't have died if they were protected. And we have now on the phone Eleni Demirtzis. Did I pronounce your last name correct, Eleni?
You did.
How about that? She is, just so you guys know, she is one of the best communications people in the business, and she's the comms director for the House Republicans down in Springfield. And she's not on today to talk about that. She actually is one of the reasons why I decided to have this, because we're at a function, a caucus function, and Eleni is pregnant. I spilled the beans there, Eleni. I don't think you can hide it anymore, though. And I remember being concerned that you were around a group of people, because if you're listening to the show earlier, I talked about how the fact that if my wife was pregnant right now, I would want her just locked up in the house around nobody, and just want her quarantined and staying safe for the 9 months. So why don't you tell me a little bit about your situation and what happened with your doctors, and we'll take it from there.
Sure. Well, first of all, thank you both for having me on. I really appreciate it. And yes, I listened to what Dr. Brown was saying earlier, and I couldn't agree more with everything that she was saying. So first and foremost, like you said, right, when you are immunocompromised, which you are when you're pregnant and also have other conditions, you think, oh, I want to stay indoors. I don't want to go out. I don't want to be in large group settings. But, while maybe you could lock your wife up in your house, most people can't. You have to go to work. You have to function out in the real world. And at the end of the day, you have to figure out, what is the best option to protect yourself in these situations, which, as we've heard the word a million times, are unprecedented times that we're in right now with a pandemic. So like you mentioned, I am currently 37 weeks pregnant. So
you're not hiding it.
Just about. No.
No.
I can keep trying, but no hope anymore. But, in the beginning of my pregnancy, I was, there was talks of the vaccine. It wasn't available yet to pregnant women. And then I would say it was about right towards the end of my first trimester that I was told, hey, the vaccine is going to be available to pregnant women. If you want to get it, you can get it. And so what I did was, in order for me to get pregnant, I had to do IVF, which is in vitro fertilization. So I had, at the time, been working directly with my IVF doctor. And so where I lucked out was that I had someone who was very knowledgeable in regards to fertility issues and potential fertility issues with vaccines, because I know that that is some information or misinformation that has been going around that, many pregnant women or women who are considering getting pregnant are worried about getting the vaccine because, it could potentially cause some kind of issues. So my doctor, again, like I said, very lucky, who also works at Northwestern, actually served in one of the task forces for vaccine research for pregnant women, specifically for the COVID vaccine. And I asked her at, I think it was my 8-week appointment with her, what are your thoughts? Should I get this? And she, without hesitation, said, there is no question in my mind if you should get this vaccine. She's like, I recommend it to all my patients. It doesn't contain the live virus, and, everyone should get it as soon as possible. And I asked the same questions that actually you asked Dr. Brown before this, which was, is there a safe time to get this? She said the exact same thing, as soon as possible. And so after that, I literally made an appointment the minute it was available to me. I also talked to my regular OBGYN doctor, who gave me similar advice. We went through my health history, and that, I think, is the key, is just everybody to be talking to their healthcare providers and making the best decision for them. And most of them will probably say, depending on your health conditions, like, it is in your best interest to get vaccine, because, as Dr. Brown said, pregnant women are immunocompromised. And so that means that if you do get sick with COVID or with anything, it's going to be worse than if you weren't pregnant. And so it's most, key that you just make sure that you're taking the best steps to keep you and your, unborn baby safe during this time.
Yeah, that's great. It is so, having gone through it so many times, having be the spouse of somebody going through it so many times myself.
Big difference there, Mark.
Big difference.
Big difference.
Big difference, yeah.
It is incredibly scary, and I think she said we went from 25% up to 31% vaccinated of pregnant women, which is obviously in the right direction, but certainly not a number what I guess the data shows maybe we should. Let me ask you this. When did you go into this thinking maybe, or did you go into it thinking that you couldn't imagine a scenario where you were taking the vaccine? What was your mindset going in? Because my mindset when this first was all going down was obviously the no way. What was your kind of mindset going into this? Was it just a baseline, let's see what they say, or what was your mindset? And then what is your doctor's mindset on COVID in general?
So initially, of course, my mindset was I'm just going to wait and see what people are saying, what the doctors are saying, what research is saying. I definitely initially wasn't like, sign me up for the vaccines, let's do this tomorrow. I wanted to get more information, understand the pros and cons, right, of what the vaccine can and can't do for me, and, any issues that I should be concerned about. And so, like I mentioned earlier, right, I work full time. So while half time we're lucky enough to be able to work remotely, we still have to go to events. We still have to be around people. I mean, we still have to be in session, right? And, I'm exposing myself to a ton of people. And so my concern was, hey, I want to do what's best for me to stay safe and also keep others safe around me. I have a 2.5-year-old that can't get vaccinated. And so I have to worry about bringing COVID home to her as well. And so my biggest concerns were, what is the best thing for me in my situation? And I don't know if I worked from home and didn't work and was able to keep away from large crowds and not associate with a ton of people, maybe I would have had a slightly different timing decision as to when I got vaccinated. But given my specific circumstances, the pros outweigh the cons in how soon and how quickly I got the vaccine.
Well, that's awesome. Well, you are my comms director, so what question would you have given me to ask you that I haven't asked or done appropriately, or have we covered everything?
Sure. I mean, the only thing I would say is that, one thing you asked about that you talked about with Dr. Brown were side effects, right? And so when I got the vaccine, I did have side effects. I had a low-grade fever for probably like 24 hours. And in my opinion, a low-grade fever for 24 hours that didn't do much other than just make me annoyed for 24 hours.
You don't want to be around Eleni when she's annoyed, trust me.
That was, a risk I was willing to deal with, which was having a low-grade fever for a day, as opposed to potentially getting COVID and ending up on a ventilator with a baby inside me and not knowing what was going to happen. So, I think, a lot of people are worried about the side effects. I mean, even non-pregnant folks that I talk to that are vaccinated are super worried about the side effects. And at the end of the day, what we're seeing is these, body aches, like, again, just as she said, a low-grade fever for a day or so, and, you kind of move on. And so, if someone thinks that is going to be worse than, being in the hospital on a ventilator or just being hospitalized at all for COVID, I think they probably should be talking to their healthcare provider more closely, because I think that the last place you want to be right now is in a hospital for any kind of reason. So that would be the only thing I would add.
Yeah, that and that's the key. There's obviously a lot of people tossing medical advice out there. Talk to your doctor, see what they have to say. Everybody's situation is obviously a little bit different, and I'm glad that you got through it well. I don't think I'm going to see you in the next 3 weeks, so good luck with everything the rest of the way.
Thank you.
Once again, thank you. Lenny, one of the best in the business. We appreciate you coming on our show.
Thank you.
Thank you. That was, I don't know.
That was great.
Yeah.
That was, you know what? That was so good, and it was so just factual. Just factual, not opinion, just factual.
Yeah,
Well done.
Those numbers that the doctor gave out on the, boy, she was prepared. 1.7, 2.4. She wasn't doing any rounding. I guess when you go to Northwestern, University of Chicago, and University of North Carolina,
they don't
round.
round up.
I think she has pi probably memorized 100 digits down or something like that.
Yeah, I got 2. I got 2 after the decimal. That's all I got.
Yeah, that's all I got.
You and the Plainfield Police Department are teaming up for a prescription drug drop-off event. It's going to be taking place this Saturday, October 9th, from 8 a.m. until 11 a.m. This will be at the Plainfield Police Department at 14300 Coyle Plus Drive in Plainfield. Again, Representative Mark Batinick and Plainfield PD prescription drug drop-off on Saturday, October 9th, from 8 until 11. That's this Saturday. They can bring by anything at all.
You bring back any prescription at all. Fortunately for me, but unfortunately, I can't be at this one because my daughter is getting married this weekend.
Man.
So we're going to have staff doing that. So big shout out to Alex and Nikki, soon to be Nikki Hoops.
Hoops.
Hoopes. That's just Alex and Nikki Hoops. So we're very excited for the big weekend. So I'm glad you gave me a good time to transition into that. I wanted to squeeze that in at some point.
So do you have the tux and everything all ready to rock and roll?
I just got everything picked up yesterday, as a matter of fact.
Nice.
So.
What color?
Gray with the green shirt.
Nice. All right.
A little bit
outdoor, indoor wedding, big church, small church.
Outdoor. We've had trouble with everybody's had trouble finding venues these days. So it's going to be in a mix, actually. An outdoor wedding with an indoor option is what it's going to be.
Okay.
So
right.
So there you go. But very much looking forward to a fun weekend.
Hey, you want to do some questions?
Yeah, let's do some questions. We always end up kicking these to the end, and then I got to be quicker than I should have been. And like you said, 20-pound worth of stuff in a 10-pound bag. So let's get the questions in.
Okay, let's get to a few of these right here. So again, Illinois questions
at gmail.com. Illinois questions at gmail.com. At gmail.com is the.
I don't know. I have a hard time with that every week. At gmail.com. Illinois questions at gmail.com. Gov's not in there.
Yep.
Okay, good. Got it. All right. Let's do Senate Bill 818. You want to do that one?
Sure.
Okay. AKA, that's the sex ed bill. So now that the governor has signed this bill, how can we ensure parents are informed of this required sex curriculum starting in kindergarten and ensure they are informed on the ability to opt out and that the school will not seek their consent?
Yeah. Are you familiar with this bill at all?
Very little, and
okay.
My ears just perked up.
Well, it is. I'll have to bring in one of the books that meets the curriculum that seems wholly inappropriate for grade schoolers, and some of the things that were talked about. So, we are the first in the state to really push the limits of what kids should be taught during sex ed. I don't know if that meets. I don't know if we're that far to the left on this particular issue. And the person is correct. We got a lot of pushback during debate on this bill. And I think one of the important things to remember about this bill in particular was there was bipartisan opposition and partisan support. So I think this just met the minimum, the 66. So the Republicans and Democrats that voted no on this. Only Democrats, though, were enough to pass it. So there was bipartisan. And usually when a bill is done that way, it's a sign that maybe it's pushing the envelope a little farther than it should be pushed. It's out of our hands at the state level now. It really comes down to school boards. And school boards and school districts are there's an opt-out option. So parents have the ability, if you want to opt out your fourth grader, third grader, kindergartner from learning certain things, you have the opt-out ability. I think the key is you need to make sure that your school district lets everybody know that the parents have the opt-out ability, right? Because they can send an email, they can send a paper home, they can send an email 10 times, they can send a text. How the school board decides to handle this is up to them. So this is one of those things where the state pushed something onto the school board, but how the school board handles it from that point is important. And yeah, I think if you go through some of the stuff that's going to be taught, and there's some articles out there, and if you look at some of the books, it's pretty extreme and to the level that I certainly wouldn't want my kids being taught. So I think the opt-out is important, but that's going to have to be done, unfortunately, at this point at the school level. I voted no on the bill. That was the best I can do. So you're going to have to talk to your local school board. So got to get locals involved.
What was the reason behind the bill? What do the proponents of it think this is going to do for our children?
You know what, and people have asked me, and we've talked about some of the stuff that's happening in schools with COVID when we were talking beforehand. There's so much. Somebody sent me an email, a question that isn't there. It didn't come through Illinois Questions, but they asked me yesterday. We passed a bill that allowed kids to opt out of the school training if there's a shooter in the school, that they could opt out on that, and that actually passed unanimously. And he was upset that it passed. I kind of my take on that, as I thought about it more, even after I talked to him. We are throwing so much at kids right now. You have kids in masks. You have kids that are fearful when the risk of them dying from COVID is really, really small if they don't have comorbidity. But you have some kids that are in their head scared about that. They're scared about shooters in school. Once again, more likely to die in a car accident than you are to be shot in a school, right? And that now we're throwing this stuff. I wish the schools were reading, writing, arithmetic, how to think, not what to think. I'm not sure why we're pushing the envelope on some of these issues. I mean, some of the topics that I believe are covered are things like the pills that stop you going through puberty, and some of these things are some of the things that are being covered and taught, and some things I don't even want to describe on the radio that are going to be taught to fourth graders. So you can email me offline if you want to have a private conversation about this. I don't want to have it on the radio, but some of the stuff that was being taught is pretty extreme. I don't know why we're being pushed in that agenda. I think some of the arguments were that, as I read this, some of the arguments were kids are victims, so they want them to be aware so that they're not a victim. But some of the things that are taught have absolutely nothing to do with that.
Okay.
So you can teach a kid not to be a victim while not teaching them descriptive sex acts at a very young age. That probably shouldn't be taught at any level. So I voted no. We're going to have to work with the school boards on the opt-out. So
okay.
There's your question.
Illinois Questions at gmail.com. Illinois Questions at gmail.com. If you have any questions, a couple of others here real quick. Can you raise the income threshold for the senior property tax freeze?
So, and this person, I believe, was in the Oswego School District. I'd love to lower everybody's property taxes. The issue is property taxes aren't just high for seniors; they're high for everybody. Mm-hmm. You raise the income level for seniors. All that really does is it's like a balloon where you squeeze one end, it blows up somewhere else. Everybody's property taxes need to be lowered. I have a bill that actually caps property taxes at 3%, and 3% is high. Right? What happens somewhere at that 3 to 4% range, I believe you actually get less money, because when you start taxing above 3 and 4%, all you start doing is decreasing the value of those properties. So the school district, the entity, it's not like they're going to, in the end, long term, you'll get money short term because there's going to be that short term bump. But as property taxes go up, values of property go down. And I think we need to freeze it for everybody. I think 3% as a cap is higher than it actually should be, but I think it's something that financially is financially doable. So we need to work on property taxes for everybody, not just seniors. There's a lot of things that go into it. We have the way our funding system works. Obviously, so much of it is done through property taxes. We've talked on previous episodes about how sharing the commercial property tax base would help with certain districts. Right now we have and have not districts. So if somebody has a big industrial base in a small district, they have the ability to spend $20,000-$30,000 per student. And then you have districts like Oswego's or Plainfield's that don't have as big of a commercial property tax base, that don't have as much money. Oswego is actually, I think the state average is around $16,000 spend per student. Oswego's around $11,500. Plainfield's around $10,500. I know those because those are big districts in my rep district. If we had more state funding or regionalized approach for commercial properties, that would do a lot to bring down property taxes. So. Okay.
This one just came into me. Just got on, listening to the show, liking it. What about the mandate for the vaccine?
Yeah, I'm. It's especially now. I'm certainly not a vaccine mandate guy. We just did a long thing on people making their own decision. And I certainly, talking to Dr. Brown, and I look at all the situations with women who are pregnant, and reasons why they should get the vaccine. I think the big one that really ties into what we're talking about with schools is, without a doubt, if you're 70, 80 years old, the data clearly shows you're better off with that vaccine, unless it's some weird circumstance. Right. The data does not show that for the 7-year-old. And California, Newsom, who's feeling all powerful because he won his recall, he is mandating that students get the vaccine. I am getting the vaccine for kids. The data shows isn't about the kids. This whole thing with COVID and all the lockdowns in the schools and all that stuff has really hurt kids more than any other group, disproportionately to how much COVID actually affects them. I've been reticent to be standing out there with the sign and protesting certain things. My job is to work within the system. If they mandate, I'll say this on the radio live right now, if they mandate school kids, and they're talking about in California, even doing it down to age 5, if they mandate for you to go to school, you have to get the vaccine anytime soon, I will be willing to stand with the sign and protest a mandate for kids, because the data just does not show it. I'm a little uncomfortable with the long-term effects of somebody who's pre-puberty. I think it's obviously different. The first show I was on, we talked about how I'm vaccinated. You know, my family members are vaccinated, but boy, mandating for kids is one that would just really, really, really bother me.
All right, you want one more?
Yeah, let's do one more.
Okay, New York State just raised its minimum age for marriage to 18, eliminating the loophole for minors to get married if they have parental and judicial consent. That makes New York, I think, the 6th state to ban child marriage. Do you or other Illinois legislators have interest in protecting Illinois minors from this similar loophole?
I think we should be the 7th state. We probably should have been the 1st state. I think we should be the 7th state. Representative Joe Sosnowski actually, I believe, has a bill for that. And I'm certainly, if that is a bill that comes to the floor that I can vote on, I'm certainly going to do that. I don't think parents should have the ability to sign off their kids into marriage before the age of 18. So,
all right,
yeah,
I'm with you there.
On that one.
All right, don't forget Representative Batinick and the Plainfield Police Department's prescription drug drop-off event this Saturday, 8 to 11 at the Plainfield Police Department, 14300 Coil Plus Drive in Plainfield. What else you got for us today, sir?
Well, in the first 50 minutes, we did about 10 pounds. Now we got to get 10 pounds worth of stuff in the last 7 minutes. I know that one thing that I wanted to touch on, I think you've been hitting pretty hard, is kind of the what's been going on at the schools. We've been talking a lot about the schools in past episodes. I know you've really talked about some of the brawls. Now it's hitting Chicagoland TV, some of the brawls that are in the Joliet schools. This is obviously a huge problem. There's also, I know at my school, I shouldn't say my school, a school my kids attend, there's been these TikTok challenges where there's been some pretty big issues with destruction in the bathrooms. I think the new thing is slapping teachers is kind of
that's for October. Slap a staff member.
Slap a staff member, and I think I read an article about it. Some school, a teacher got punched, actually not slapped, but punched. Once again, when you keep kids out of school that long, and they get sucked into just social media, and they get sucked into this virtual world, it's not good for them. I mean, we are going to look back. And I don't know how you feel on this. You can let me know. I think we're going to look back on what we've done for kids with COVID the last couple of, almost 2 years, really. And it's really been a detriment. And I'm concerned about what that effect is going to have as they go through high school and college and everything else. We've had a really weird time for kids in the isolation. I mean, we know isolation makes people unhappy, right?
Sure.
Most people, anyway. I do have some friends who maybe they're just telling me they like to be alone. I do have some friends, but they're adults, and kids need that social interaction. And I think what we've done the last couple of years is almost 2 years now, is I guess a year and a half has been really rough on kids. So whether it be the violence at some of the local schools, or whether it be the TikTok challenge, that's pretty rough. And I'm actually Mayor Lightfoot, to that, she's been in the news a little bit lately. She actually called in the question. I'm grateful for this part. She called in the question the quarantine rules. I don't know if you saw that article, but
I saw her arguing with Kim Fox. I didn't see this yet.
Oh, we'll get into that argument a little bit later. But she actually thought the quarantine rules were a little bit too restrictive.
Sure, they are. Absolutely are.
And we talked about there was a school in the city of Chicago, 3 COVID cases. They closed it for 14 days. 3 COVID cases in the entire school. They closed the entire school for 14 days. And the reality is those kids are probably still playing with each other to a certain extent.
Yeah.
And I would say this, and my wife, who is going to be on an upcoming show eventually here, my wife is a special ed teacher at the Valley View School District. And for some of these kids, school is where they eat. School is where they get breakfast, lunch, and love.
Yep.
Right? And it's for some of these kids to be off for 14 days is a pretty big risk factor.
Yeah,
and I would say a bigger risk factor than COVID provides for those kids. One of the things that dropped was the reports of domestic abuse, because usually when kids are found to be abused, it's usually found in the school.
Yep.
Right? If you're not going to school, you're not recognizing that abuse. So I am grateful that Mayor Lightfoot is pushing back a little bit on getting the kids to stay in school and the need for them to get in school. But Kim Fox, what do you think of that situation?
Hey, real quick, you asked me 2 things, and
Yes.
we can get into this in detail later on because we only have a few minutes left here. The biggest, I think we'll look back and it won't take 5 years or 10 years. It'll take just a couple of years. The 2 biggest mistakes we made: kids, quarantine, keeping them away from school, and the amount of money we've thrown around and given to municipalities and school districts and counties. I mean, it's amazing. And what has been done with some of that money?
Yeah, that's the part.
Inexcusable.
Yeah, the no strings attached thing was certainly
in the name of COVID.
Right.
Big problem with that. We can talk about that later.
Yeah, that's another 10 pounds. We don't have time to add to that in this episode.
So I talked about it on my show today. Fox and Lightfoot are going back and forth because of the gang shooting in Austin last Friday. She called it, Fox did, mutual combatants. We can't press charges. I mean, we know who these people are. They have license plates. They have pictures. They have everything. They have the video of the guy getting killed, and they're mutual combatants.
Yeah, and I believe there might have even been some police officers
right there.
that were witnesses.
Yeah.
And I thought, when there's a bar fight, if I got into a bar fight, the cops come in, they arrest everybody that's fighting, right?
You think so?
But apparently, if it's a shooting and a gun battle and they're mutual combatants, they don't have the ability to look.
What the hell's going on?
This is an economic problem as well as a personal and violence problem. There are Ken Griffin is I believe the richest man in the state of Illinois. And
okay.
He spoke to the Economic Club of Chicago on Monday. And I didn't realize this. Said Chicago remains a corporate headquarters, but the firm's New York office is now the central point with well over 1,000 employees. He has cited increased crime and violence on the streets of Chicago as one of several reasons why the Citadel, which has $38 billion in assets under management, why they may leave.
Wow.
This is his quote: "Chicago's like Afghanistan on a good day, and that's a problem." He went on to talk about city and state leaders over issues including broken public schools, high taxes, pension reform, and crime. It was interesting because I saw this article on Twitter and I saw a lot of pushback, a lot of people saying, don't let the door hit you on the way out. He has the ability to talk about this, but I was actually at a small business 2 days ago talking with a business that potentially wants to leave the state because of all the things he represents. When he's speaking, there's 1,000 other business owners behind him and tens of thousands, if not hundreds of thousands of jobs. But here's another interesting fact about businesses and people like this. Founded the Citadel in 1990 and built it into one of the largest hedge funds in the world, is worth a reported $16 billion. He has donated more than $1 billion to organizations such as the Art Institute, the Museum of Modern Art, the Museum of Science and Industry, which announced it would be renamed in his honor. It is I talk to a lot of business people that aren't going to be quoted in Crain's or the Tribune, and this is what they tell me. They say, you know what? We want to keep it quiet. We don't want to let anybody know because they fear retribution, whether it be their property tax bill or regulation or somebody coming in. They fear retribution. Quiet, quiet, quiet. Snap their fingers and they just quietly leave and they're gone.
Wow.
I'm glad somebody's talking and fighting back. It's bad for the city. It's bad for the state to get this press. You know, New York has high taxes, right? But we've talked about this in previous shows. The carjacking rate and the murder rate is just a fraction in New York what it is here.
Oh, yeah.
And there's obviously Chicago. People want to compare, and I think it actually was on the intro coming into our show. I think St. Louis is one of the largest that has a high murder rate. We are not St. Louis. We are Chicago. We should be comparing ourselves to Los Angeles and New York, not to towns like St. Louis.
Yeah.
We should have a murder rate lower than New York and Los Angeles, and we need to act like a world-class city, and we need to start doing world-class things. We need to have world-class education. We talked on the previous shows, we paid for a world-class stadium. We just didn't get a world-class stadium. If we had a world-class stadium, we would have world-class events like the Super Bowl. We didn't get that because of politicians and people get in the way. So I'm glad somebody's standing up, but there are many, many people that are represented by comments like this. I have a gentleman that lives near me in my subdivision that has a business in Chicago and said, man, the streets are quiet. It's scary. Friends are moving from one part to another part because it's spreading. We have to address this. And the idea, I mean, when you have a shootout on tape and you can't find a way
to get somebody behind bars.
Couple shout outs, because I know we're approaching the end. I donated to CWB Chicago, which actually tracks and does a lot of good reporting on what's happening in the city. If you can report, that'd be great. And I also John Cass has I think it's John Cass News. He's doing his own blog
is
now.
He really? Okay.
Yeah, and he did a really nice write up. I put it on my Facebook page. It's part of the 10 pounds that we really won't get into. But he cites a lot of things, and it's what kills me the most is this is a good quote. The criminal justice system is broken. Minority poor are overwhelmingly the victims of violent Chicago crime, and people aren't doing enough about it. It's the poor and the minorities that are getting hurt the most by this, and it's an absolute shame. So, how much time you got? What else do you think we
got? About a minute.
We got about a minute. Well, I am going to end this once again.
Have fun at the wedding.
Yeah, I'm going to end it with a couple things. White Sox playoffs this weekend.
Somebody please act like you care. No one's talking about it. They're in the playoffs.
Yeah, they're in the playoffs. One of the frustrating things for me is we get a Thursday and Friday, like mid-afternoon games.
307 and 107.
Yeah, it's like, come on. I mean, put us on. I remember when they made that switch, they didn't like two games at the same time. Well, now somebody who has the day off in Kansas can watch the White Sox, but a guy who has to work in Chicago can't watch the Sox game on Thursday and Friday. I don't care if there's two games at the same time. That's fine. We can toggle back and forth.
That's right.
So go White Sox, Nikki and Alex. I'm excited about that, and everybody keep fighting. CWB Chicago. Donate if you can.
It's good. Very good website. I use it a lot during my show.
Yeah, good. Hey Jackass is another good one.
Okay,
another good one, and JohnCastNews.com.